clitoris contains approximately 8,000 nerve endings, making it the most densely innervated structure in the entire human body. Yet, most people don't know that what they can see is only a small fraction of this complex organ system. Today, we're going to explore the fascinating science of female sexual health and physiology, diving deep into the anatomy, biological responses, and the many factors that influence sexual experience. The clitoris is far more than just the small, visible structure most people recognize. It's an extensive organ system. The glands and shaft are externally visible, but the structure extends internally with paired legs called crura that can reach 10 centimeters in length. Additionally, the vestibular bulbs are positioned on either side of the vaginal opening. These internal structures contain erectile tissue that becomes engorged with blood during arousal, similar to male erectile tissue. This complex anatomy explains why arousal and pleasure can result from various types of stimulation, even when the external glands isn't directly touched. The vagina itself contains various regions with different nerve distributions. The anterior vaginal wall, particularly an area located several centimeters inside along the front wall, has been identified by some researchers as having heightened sensitivity. The cervix, located at the deepest part of the vaginal canal, also contains nerve endings that some individuals find responsive to stimulation. It's important to understand that sensitivity and response patterns vary significantly among individuals. There is no single anatomical map that applies universally. Beyond the genitals, many areas of the body can produce pleasurable sensations when stimulated. The nipples represent a particularly notable example. Each nipple contains hundreds of nerve endings, and research using brain imaging has shown that nipple stimulation activates the same regions of the sensory cortex as genital stimulation. Other commonly reported erogenous zones include the neck, ears, inner thighs, and lower back, though individual preferences vary considerably. Now let's examine the arousal response. Sexual arousal begins in the brain, where psychological factors, sensory input, and hormonal signals converge. When arousal occurs, the nervous system triggers a cascade of physiological responses throughout the body. Neural signals travel from the brain through the spinal cord to the pelvic region, activating various physiological changes. The parasympathetic nervous system plays a primary role in the arousal phase, while the sympathetic nervous system becomes more active during orgasm itself. Multiple body systems respond during sexual arousal. Blood flow increases dramatically to the genital region, causing engorgement of erectile tissues in the clitoris and vestibular bulbs. The vaginal walls become engorged as well, and specialized glands begin producing lubrication. The Bartholin's glands, located near the vaginal opening, and the Skene's glands, positioned near the urethra, contribute to natural lubrication. The vaginal walls themselves also produce transudate, a fluid that seeps through the tissue. This lubrication serves multiple functions, including reducing friction and facilitating comfort during any penetrative activity. Beyond the genital area, arousal affects the entire body. Heart rate increases, breathing becomes deeper and more rapid, blood pressure rises, and muscle tension increases throughout the body, a phenomenon called myotonia. The skin may flush, particularly across the chest and face, due to increased blood flow. Orgasm represents a peak physiological response characterized by rhythmic muscular contractions. These contractions typically occur in the pelvic floor muscles, the vagina, the uterus, and sometimes the anal sphincter. They usually occur at intervals of approximately 0.8 of a second, though duration and intensity vary considerably. During orgasm, brain imaging studies show activation across multiple brain regions, including areas involved in reward, emotion, sensory processing, and motor control. The experience involves both physical and psychological components that are deeply interconnected. Some individuals experience a phenomenon involving fluid expulsion from the urethra during or near orgasm. Research has shown this fluid contains varying mixtures of components, and its occurrence varies significantly among individuals. Following orgasm, the body gradually returns to its baseline state. Blood flow to the genitals decreases, muscle tension releases, and heart rate and breathing normalize. This resolution period varies considerably in length. An important distinction exists between male and female sexual physiology regarding the refractory period. While males typically require a recovery interval before achieving another orgasm, many females can experience multiple orgasms in succession without a refractory period. Let's now discuss individual variation and the many factors that influence sexual response. Sexual response varies tremendously among individuals. Some people achieve orgasm relatively easily through various forms of stimulation, while others require specific types of stimulation or extended periods of arousal. This variation is completely normal and reflects differences in anatomy, nervous system sensitivity, hormonal profiles, and psychological factors. Research consistently shows that most women require direct or indirect clitoral stimulation to achieve orgasm. Orgasm from vaginal penetration alone, without any clitoral involvement, occurs in a minority of women. Understanding this can help set realistic expectations and reduce unnecessary concerns. Hormonal fluctuations throughout the menstrual cycle can affect arousal, sensitivity, and ease of orgasm. Estrogen and testosterone both play roles in sexual desire and response. During pregnancy and postpartum periods, dramatic hormonal shifts can significantly alter sexual experience. Menopause brings substantial hormonal changes that affect many aspects of sexual function. Decreased estrogen can lead to vaginal tissue changes, reduced natural lubrication, and sometimes altered sensation. Hormonal contraceptives can also influence sexual response, though effects vary considerably among individuals. Sexual response is profoundly influenced by psychological state. Stress, anxiety, depression, and fatigue can all diminish arousal and make orgasm more difficult to achieve. Conversely, feeling relaxed, safe, and emotionally connected can enhance sexual response. The quality of intimate relationships significantly affects sexual experience. Trust, communication, emotional intimacy, and relationship satisfaction all correlate with sexual satisfaction and function. Cultural attitudes toward sexuality, religious teachings, and social messaging all shape individual sexual experience. Societies that promote shame or stigma around female sexuality can create psychological barriers that interfere with natural sexual response. Education plays a crucial role. Comprehensive, accurate sexual health education helps individuals understand their bodies, communicate their needs, and approach sexuality with confidence rather than shame or confusion. Previous negative sexual experiences, including abuse or assault, can significantly impact sexual function and experience. Trauma can create associations between sexual activity and danger or distress, making relaxation and arousal difficult. Professional support from therapists specializing in sexual health or trauma can be valuable in addressing these concerns. Various medical conditions can affect sexual function, including diabetes, cardiovascular disease, neurological conditions, and chronic pain disorders. Many medications, including certain antidepressants, blood pressure medications, and antihistamines, can influence arousal, lubrication, and ability to achieve orgasm. Anyone experiencing persistent changes in sexual function should consult with healthcare providers, as these changes can sometimes indicate underlying health issues requiring attention. Now, let's consider some practical considerations for sexual health. Open communication about preferences, boundaries, and experiences is fundamental to satisfying sexual experiences. Partners benefit from discussing what feels pleasurable, what doesn't, and how to create mutually enjoyable experiences. Many people find it challenging to discuss sexual topics, but developing this communication skill enhances both sexual satisfaction and overall relationship quality. Difficulty achieving orgasm, pain during sexual activity, or lack of interest in sexual activity are all concerns that deserve attention. These experiences are common, and effective treatments and approaches exist for most sexual health concerns. Healthcare providers, including gynecologists, primary care physicians, and specialists in sexual medicine, can provide guidance and treatment options. Sex therapists offer psychological approaches that address relational and emotional factors affecting sexual function. When natural lubrication is insufficient due to hormonal factors, medications, or other reasons, commercial lubricants provide an effective solution. Water-based and silicone-based lubricants are widely available and can significantly enhance comfort during sexual activity. Female orgasm is not required for conception to occur. However, some research suggests that orgasm might potentially enhance fertility through mechanisms like cervical contractions that could assist sperm transport, though this remains an area of ongoing investigation. Understanding female sexual health and physiology involves recognizing the intricate interplay of anatomical structures, physiological processes, hormonal influences, and psychological factors. Individual variation is substantial and normal. Sexual health represents an important component of overall well-being, encompassing physical health, emotional satisfaction, and interpersonal connection. Approaching this topic with accurate information, open communication, and respect for individual differences creates a foundation for positive sexual health throughout life. This information is provided for educational purposes and does not replace professional medical advice. Individuals with specific health concerns should consult qualified healthcare providers.